I'm here in Mitcham today to find out how link workers can take the pressure off doctors and to find out about the important role they play in a patient's journey. Link workers like Simon see people who've often been referred to a social prescribing service by their GP. I wanted to find out more about how GPs and link workers can support one another and ultimately help their patients.
In my role as a link worker, I am a bridge between community services and the GP. I take referrals from the GP for people whose health isn't the best, but it's issues that aren't necessarily medical. So when we have the consultations with patients, depends on the patient what the outcome is, what kind of service they need. It might be someone who's sort of isolated. We can find them hobbies, groups, local community services that can support them. It can be like a sewing group, it can be like exercise groups. If it's someone who's struggling with a mental illness, it can be sort of therapy groups or safe spaces where they can go.
Link workers like Simon work closely with GPs like Dr Sekeram.
So the benefits of having a social prescribing service in-house in the practice are numerous. Being a GP, I see lots of patients who come and see me with social root cause problems, and it's estimated that 1 in 5 individuals will have a social root cause issue. I think it's higher than that, and I'm certainly seeing it all the time. Lots of factors impact on health and well-being, and lots of factors including social factors of things like loneliness, housing, relationships. And if we don't address and resolve those social issues, they get worse and worse and worse, and they may develop into physical symptoms, so headaches, rash, tiredness, tired all the time. And if they get to that point, they may then find themselves seeing a doctor, and the doctor may unfortunately medicalise the issue, not really address the social root cause problem.
I think the practice benefits overall. I mean, a lot of patients will book repeat appointments because they might be stuck, they might not know what to do, they know they need help, they know they need support, but they're not necessarily equipped to sort of seek that themselves, or they have struggled when they sought that themselves. So hopefully we can kind of break that cycle a little bit, get them connected with more long-term support, get them involved in local services that are better equipped to help them than a GP.
Social prescribing helps doctors and patients alike. Outi was referred to her link worker following some sudden changes in her life, which resulted in her losing both her job and her home. Whilst these weren't medical issues her doctor could help her with, it was affecting her health. And this is where social prescribing link workers come in.
When I lost my home, I had a panic attack, but at the time I thought I had a heart attack. I felt like I had lost everything, and I felt really down. So when I was visiting my link worker, Sarah, she had time for me. If you go and see a GP, you only get 10 minutes, and that's definitely not enough to get everything out of your chest. But I felt that I was listened to, and I felt that I'm going somewhere. It got me thinking about that there is still life left for me, and things will change. You have to work for it, but there is help around.
So social prescribing doesn't replace medicine. That's not what GPs are trying to do, that's not what we're trying to do, but it can really work well alongside other forms of intervention.
So having a social prescribing service in the practice has been wonderful. I'm now being able to really address those root cause problems, and as a result of that we found that there was an improvement in wellbeing scores by 30%. We also saw a reduction in GP appointments by 30% as well, and me as a clinician, I'm able to improve my satisfaction, and my burnout rates as well as improved as a result of being able to support these individuals, which I wasn't able to do before.